Stroke innovation. How prevalent are strokes today? Stroke is the third leading cause of death for women throughout the world. Women are at a higher risk of stroke than are men, as 60% of deaths due to stroke are women. Each year, 55,000 more strokes occur in women than in men. Strokes are so common that every 4 minutes someone dies of a stroke, and every 40 seconds a stroke occurs. Who is at risk for stroke? Risk for stroke varies with gender, race, and ethnicity. Women are at a higher risk, as well as African Americans. Women account for 60% of stroke deaths. Those participating in certain lifestyle behaviors are also at a higher risk, which includes obesity, physical inactivity, excessive tobacco or alcohol use, large amounts of stress, unhealthy eating habits, and not adhering to medications to treat problems such as high blood pressure. So why are women at a higher risk to stroke than men? There are several risk factors that are unique to women, which include pregnancy, oral contraceptive use, the use of hormone replacement therapies. Pregnancy increases one risk for stroke, exhibiting 21 in 100,000 pregnant women. A reason for this is that pregnancy may increase one's blood pressure, which is a known link to stroke. Both pregnancy and the postpartum period put women at an elevated risk for stroke, accounting for 18% of strokes in women under the age of 35. Other factors that put women at risk of stroke include high blood pressure, type 2 diabetes, cardiovascular disease, and smoking. Women face a higher risk of stroke and contribute to more deaths in women than in men. 1 in 5 women will have a stroke within their lifetime. Increased risk is due to pregnancy and preeclampsia, oral birth control, hormone replacement therapies, migraines with aura, smoking, and AFib. Strokes can occur at any age and at any time. Each year, 1 in 5,000 women ages 15 to 49 suffer a stroke. It has been observed that 1 in 5 strokes occur in working-aged adults, and 5% of strokes occur in people aged 45 and younger. Strokes in those of younger ages creates more of an economic impact due to disability. Many of these individuals are still in the working force, have greater family obligations, and other financial responsibilities that require full-time employment. The disability-adjusted life years is predicted to be 61 million by the year 2020. A majority of strokes are preventable, with modifying lifestyle behaviors and combating common misconceptions that are associated with the disease. 80% of strokes are found to be preventable through the adoption of healthier lifestyle behaviors. Some common misconceptions that surround stroke include the beliefs that stroke only occur in the elderly, they cannot be prevented, and there is no treatment. Lifestyle modifications can help to prevent stroke, which include proper exercise, eating healthy, and adhering to necessary medications. It has been noted that proper treatment and medication adherence for high blood pressure can reduce stroke risk by up to 40%. Strokes are preventable and treatable. Some key preventive measures include lowering one's blood pressure and limiting daily sodium intake. The mnemonic FAST was created by the National Stroke Association as a way to remember and identify stroke symptoms and the importance of acting in a timely manner. The F in the mnemonic stands for face, to identify if the individual has any drooping of the face. A stands for arms. Is the individual able to raise both arms? Is there any weakness? S is for speech. Is the individual's speech different or slurred? T represents time. If any of these signs are observed, then it is imperative that one seeks medical treatment as soon as possible. Goals of stroke interventions aim to increase knowledge and awareness of signs and symptoms of stroke and what to do once stroke is suspected. A strength with this mnemonic is that it is less complex and easy to remember. Treatment for stroke is available with tissue plasminogen activator, but it is only effective if used within 4.5 hours of symptom onset. This treatment can reduce the odds of disability and severity of stroke. A problem with this treatment is how there is only a small window of time where it can be used, and many stroke patients delay medical care and arrive too late for TPA to be effective. This delay in seeking medical treatment can be due to the lack of awareness of stroke signs and symptoms, writing symptoms off as a headache that will go away, along with believing in the misconceptions that surround stroke, such as believing one is too young or too healthy to have a stroke. Promptly recognizing stroke symptoms can lead to faster and more effective treatment. The CDC's Division for Heart Disease and Stroke Prevention aims to create a heart-healthy and stroke-free world. This division helps to fund programs that provide funding, research, and support to state health departments and other partners. This division helps to track trends in surveillance in cardiovascular risk factors and differences in distributions of stroke and cardiovascular disease by age, socioeconomic status, gender, race, and ethnicity, as well as geographic location. Goals of this division include the prevention of risk factors of heart disease and stroke, to increase detection and early detection and treatment of risk factors, and to prevent recurrences. Wise Woman is a program designed to help low-income, underinsured, or uninsured women, ages 40 to 64, understand and reduce their stroke risk. This program provides screenings and support and touched upon the theoretical concept of socio-ecological model to alter behavior and community practices to increase reach and effectiveness of the program. Many of the women targeted within this innovation have limited access to medical services, and with the socio-ecological model as a framework utilized, it is recognized how the environment has an impact on these women, and the goal is to create better support and access. Wise Woman has had several successful initiatives in Vermont, Alaska, and Rhode Island. In Vermont, the program is referred to as Ladies First, and it has helped to improve access to healthier food options, giving coupons to purchase locally grown fruits and vegetables. It has been noted that each day, 2 women die in Vermont from heart disease and stroke, and poor nutrition is a concern. In Alaska, 1 woman dies from heart disease or stroke per day. This program was introduced to 18 Native communities throughout Alaska, helping to provide annual wellness services in isolated areas where climate and geographical locations create challenges for women to obtain care. These wellness services aim to educate on promoting better lifestyle behaviors. In Rhode Island, 4 women die per day from heart disease or stroke. This program helps to provide lifestyle programs and resources to help decrease the burden of disease. There are several strengths and weaknesses associated with this initiative. Some strengths include the fact that it specifically targets women, which suffer a greater burden from stroke as compared to men. The program addresses lifestyle behaviors and aids in increasing access to healthier food options, wellness services, and health-promoting programs to help prevent the occurrence of stroke and cardiovascular diseases and such risk factors. Some weaknesses lie in the fact that this program is not available in every state. It is also only targeting women who are ages 40 to 64, underinsured or uninsured, and those that are of low income. Stroke does not discriminate and can happen to anyone at any age and from any economic background. Most stroke interventions have circled around teaching the signs and symptoms of stroke, but many lack educating the population on the risks in women and the possibility of stroke in younger age groups. Improvements need to be made to educate women on their unique risk factors and symptoms regarding stroke, along with the fact that no matter one's age, a stroke is possible. Another important aspect to educate on is that there are treatment options for stroke, as long as one gets to the hospital immediately if one is suspected, and to better inform how to detect a stroke. Stroke knowledge is not routinely discussed during women wellness and physical exams, especially for younger women. A new intervention can be aimed at presenting stroke awareness during such exams. Another way of teaching about stroke signs would be to disperse survey questionnaires along with an incentive that would promote health, such as a free week membership at a local gym after participating in such survey. With stroke care, timing is everything, and women of all ages need to be aware of their risks. It is the hope that through the diffusion of innovation, these women who adopt the innovation will spread the knowledge onto their peers. The health belief model applies to stroke in regards to perceived risk. According to the health belief model, actions and behaviors are dependent upon how a person perceives the disease and how they perceive themselves and their own health. If one perceives themselves as having low risk for stroke, then they are less likely to adhere to medications and participate in health-promoting behaviors that will reduce one's risk. It is the hope that with this novel innovation, women of all ages, especially those under 40, will understand and be aware of their stroke risk and adopt more health-promoting behaviors to reduce their overall risk. With the social cognitive theory, it entails how one's experience, knowledge, and environment have an effect on their health and behavior. With stroke, there is a lack of knowledge of the importance of obtaining immediate medical care when stroke is suspected, a lack of knowledge of unique signs and symptoms, as well as a lack of knowledge to treatment options following stroke. Knowledge is necessary to change behavior into one that is health promoting. The purpose of the intervention would be to increase stroke knowledge, awareness, and self-efficacy, and would target women. The population would be sampled from women having wellness exams and would require cooperation and participation with physicians and local gyms for trial memberships. Short-term goals would include gaining knowledge on stroke along with starting to participate in physical activities and other health-promoting behaviors with the intermediate-term goal of joining a gym membership and the ability to detect stroke. Long-term goal would be to reduce the burden of disease due to stroke. Interventions must study all aspects of the population of interest to gain an understanding of any potential barriers that contribute to the burden of disease, as much as the disease burden from stroke is due to modifiable lifestyle behaviors.